That's kind of cool. I don't know what it's doing, but hey, everybody. Little different video today. I want to talk about the WPATH standards of care, or the used to be, I believe, the Harry S. Benjamin standards of care. Um, just every so often you hear we follow the standards of care, we believe in the standards of care, and it's been a while since I had read them. I read them a long time ago, and then I wanted to reread them, and I've referenced them every so often, and I just think it's good to be knowledgeable, and so I just wanted to talk a little bit about them. Um, when I contacted my company, and we talked about having surgery or hormones, or any of those things that are part of your transition if you're on this journey, they always refer to the standards of care. The standards of care, and in the case of my surgery, the insurance company wants you to follow everything you need to, the standards of care, and they kind of like say you have to adhere to the standards of care or follow the standards of care, or you're seeking a mental health professional who will state that you're following the standards of care. So they always kind of go back to the standards of care, which to me, it almost sounds like the standards of care are like these written in stone rules, or rules that you have to follow them. Step one, open can. Step two, drink soda can. Step three, recycle soda can. And it just, there were some things that kind of stuck out of my mind, and I just want to point these out. And this is, I'm going to go through the document here on page 2. It says here in the heading, the standards of care are flexible clinical guidelines. And it says here, the first sentence, the standards of care are intended to be flexible in order to meet the needs of folk, transgender folk and whatnot. And then later on it goes here and it says, standards of care are clinical guidelines. Individual health professionals and programs may modify them. Departures from the standards of care may come about because of a patient's unique situation, what's going on. And then later it talks about some patients who present for care will have made significant self-directed progress. Now I realize that's a lot of, I don't know if you can see the highlights, what I just read, but the way that I look at that, again, it's to say that yes, these are good rules, these are ideas, people have agreed this is a good idea, but it is not a set of rules like XYZ, you must do 1, 2, 3 to get to what you're after. A bit that professionals may modify them. So I think kind of for a person who maybe has their stuff together, which I like to think that I do, some of it kind of gets a little repetitive, but I understand the need for it. And maybe repetitive is not the right word, but I personally have a bit of a challenge with the 1-year RLE requirement for surgery, but I understand the reasoning behind it, which we'll talk about in a minute. But I guess what I'm trying to say is I had someone, criticize and say, that I needed to slow down because the standards of care, you have to do this, you have to do this, you have to do this. And I wanted to say to them, you're absolutely right in one way. But in another way, the standards of care, they even say themselves, they're flexible, they're guidelines, they're not hard and fast rules. But there's a reason why there's certain restrictions, and time is one of them. In my case here, looking for surgery, 2 referrals, one from a therapist, the other from an evaluative role. And basically, basically just saying that it says here, an exclamation in the letters that criteria for surgery have been met. Okay. So on the one hand, they say, well, these are guidelines and they can be tailor-made. And then a couple pages later, it says, and then the professional is going to say that these criteria have been met. So the criteria by the professionals that they themselves can modify based on your own needs for one person who might have really deep issues, maybe some other unrelated or related things, they may need more time. And that's, I think, it gives a little bit of flexibility based off an individual situation. In my opinion, if you kind of have your stuff together, then maybe you don't need all that time. But again, we'll get to that in a minute. Okay. Criteria for surgeries. It says here, while the standards of care allow for an individualized approach to best meet a patient's needs, the criterion for all surgeries is persistent gender dysphoria by a qualified mental health professional. So in other words, the professional has to agree and say, yes, so-and-so does have gender dysphoria. And then it says here, furthermore, for some surgeries, additional criteria and 1 year of continuous living in a gender role, which I kind of disagree with, but we'll get to why it's good in a moment. And I only say that because, and I think they would say that flexibility, if someone is going to do themselves harm or whatnot, then probably waiting a year is not that good of a deal. But I can also see it being kind of opening the door for someone who's impatient and maybe shortcuts it and does not. They're setting yourself up for failure if you rush it. It says here further that, again, back to this idea, 12 continuous months of living in a gender role that is congruent with gender identity. Okay, so it's saying 12 continuous months of living in a gender role that is congruent with gender identity. Right there, it does not say what that means. Does that mean full-time? Does that mean changing your driver's license? Does that mean, in my case, I went full-time in January of, in December, actually, of 2016. So does that mean that I can't do anything until December of 2017? Which I think the common consensus would be yes. However, with the exception of going to work, I lived in this gender role 24/7. I did not, when I picked up my daughter from school, I did dress gender neutral. But as far as being at home and going to the grocery store or going to the mall or going to see a movie, going to play somewhere, I was living in the female gender role. So I would have kind of issue with that. But let's continue on the thought. It even says the rationale for the 12 months RLE is the experience provides ample opportunity for patients to experience and socially adjust to their desired gender role. And a little further down it says, the duration of 12 months allows for a range of different life experiences and events that may occur throughout the year, family events, holidays, vacations, season-specific work or school experiences. And then here's the kicker. Here's where it comes in. During this time, patients should present consistently on a day-to-day basis and across all settings of life in their desired role. This includes coming out to partners, family, friends, and community members at work and school and other settings. So see, that's where I think for me it knocks my little argument out because it's saying, okay, this is the rationale why we have the 12, and that's why it's important. And it says here, health professionals should clearly document the patient's experience in the gender role in their medical chart, including the start date of living full-time for preparing general surgery. So again, based off of the standards of care, there's really not a way out of that 1 year RLE. And it's one of those things that, again, it bothers me to a degree, but at the same time, I can understand why. And, God forbid someone who's not ready for the surgery and is not prepared themselves, what a tragedy it would be for that person if they had the irreversible surgery and it was not meant to be. So again, I understand the rationale behind it, but I also kind of, again, I feel like, I guess on the one hand, again, I feel like if you have your stuff together and, uh, the 1 year is kind of ho hum, ho hum. On the other hand, um, the more that I experience the process, um, I'm doing stuff in that 1 year. I'm not, I can't have the surgery, but to have the surgery, I have to get the area cleared of hair, which is electrolysis. Electrolysis, which could be anywhere. They say 6 sessions, 6 weeks apart. That's 9 months, and so I'm gonna sneeze. Excuse me. And so at that point, you do have your year. Your year is going to go by, but the challenge I have for that is that some folk that I've talked to as far as getting ready for the surgery are like, well, we're not going to process your record until you reach the 12 year. And I've always looked at that as saying, okay, the starting line for you to start your race is 1 year. Whereas at my point, or from my perspective, it's the finish line is 12 months. I want to get all my stuff in a row, get all my letters done, get everything ready to go, and says, okay, it's, December. My year is up. I have all my stuff in order. I'm clear. Let's do it. You know what I mean? So again, a little different perspective, but again, I just wanted to talk about it. And, in summary, the standards of care are there to protect you, protect me, protect whomever, protect the surgeons and the therapists in a way to make sure that we do all these steps. As a footnote, from as recently as this morning, and speaking with one of my family members who asked me how I was doing and what I was up to, and I mentioned today, I said, oh, well, yeah, I'm kind of excited. Today's my first day of electrolysis. And the person asked me about it like, any other person, oh, that's cool. Well, what are you getting done? And then I said it, and it was like, well, I don't understand why you're doing that now. And I got a little frustrated because I'm like, I've been having this conversation with you for 27 years, and every time we go through this, that everything has to line up. It's like the planets have to be in the right alignment for those, 3 letters, and this has to happen, and this has to happen, and it's going to take 9 months to get the area clear of hair, and the surgeon books their surgeries, 6 to 8 months in advance. So if I waited till the last moment, I may have to wait another year anyway. So, it's hard. People don't understand that. They're thinking, oh, I broke my finger, I have to get surgery on it. And I wanted just so much to say, imagine for a moment that you did break your finger or your wrist or your arm or your foot or your ankle. And the surgeon said, well, Mrs. So-and-so, I would like to help you. So I need 3 letters from 3 other physicians that say that your ankle is honestly broken and that only surgery will fix it. And once you get those 3 letters, you're going to have to wait a year to get your ankle fixed, just to make sure you really want to get your ankle fixed. And then once that year is up, come back and see me. And you'll have to wait 2 or 3 months to see me. And then I'll schedule your surgery probably for 6 to 8 months later. In the meantime, just wrap up your ankle. Good luck. I'll see you in 2 years. Bye. That is, in my opinion, very sarcastic on my half, but that's the feeling that I guess I want to convey. That's the feeling that I feel right now. I understand there's a process. I understand the reason for it, but when you talk to someone else and they're like, well, I don't understand why you're doing it now. And you're like, well, even though I can't have the surgery for 6 months or a year or 16 months or 12, I got to start sometime. So why not now? All right, I'm out of time. Goodbye. See ya. Good luck.